Welcome, everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 123,154 confirmed cases of COVID-19 in Canada and 40,870 cases in Ontario. Chatham-Kent has 360 cases, and Sarnia-Lambton has reported 336 cases. Michigan now has 93,662 cases, with 13,253 cases being in Detroit. Today, we are reporting 2,450 cases of COVID-19 in our community, an increase of 1 case from yesterday, a member of our community acquired through community spread. 103 of our cases are active and are being followed by our health unit. 2,276 people have now resolved, 92 people are self-isolating, and 7 people are in the hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 67% are male and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 2 retirement homes are currently experiencing a COVID outbreak, and 2 workplaces in the agri-farm sector are experiencing an outbreak at this time. Symptoms of COVID can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, if you're feeling confused or losing consciousness. Windsor-Essex has 2 COVID assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your result, please contact the assessment center or healthcare provider that initiated the test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you again for joining us today. As we continue to talk about the school reopening, it is understandable that parents and guardians are experiencing fear, stress, and anxiety about their children returning to school. While online learning is available for all students, it is recognized that this is only an option for certain families and that the social and educational benefits of the in-person classrooms are difficult to replace. The health unit has been working tirelessly to ensure school boards are using the best available evidence and are informed of the public health recommendations once the school years begin. Resources like the School Reopening Toolkit have been provided and are consistently being updated. Our website for schools and school board is strengthened with new information on a daily basis. Communication with school board is occurring multiple times throughout the day and week. Each school is unique, and ongoing conversation with boards as well as private schools are essential in addressing the unique challenges and situations with the interest of student and public safety as the top priority. In addition to the support offered to school, the Windsor-Essex County Health Unit is developing a return to school website, which will provide parents and guardians with the information they need to educate children on the best way to keep themselves healthy when they return to school. It is crucial that the adults in students' life are informed and on the measures that can be taken by themselves and the students, whether they are learning at home or in the classroom, to keep up with their health and well-being. In this regard, we encourage parents and all members of the community to visit our website regularly for most up-to-date information and guidance related to COVID-19 in schools and other public settings. It is important to emphasize that there is no risk-free option. Sending your kids to school may increase the risk of getting COVID-19 in the class settings. Keeping your kids at home may have an effect on their social and developmental well-being, and it will not necessarily prevent you or your family from getting COVID-19. The only right decision here is what is right for you, your children, and your family. No one can guarantee that your child will not contract COVID. We can all provide guidance on how best to protect our children when they are in school, and I want to make sure that we understand our responsibility as well. Whether you have decided to keep your children at home or to send them to school, the Windsor-Essex County Health Unit will continue to support the community to keep COVID-19 cases in the community low, have measures in place to contain the virus as soon as it's identified, to prevent further spread and keep the community informed as best as we can, to empower children, parents, schools, and everyone else in the community to do their part in keeping our community safe. I have said this before and I will say it again. We all have a responsibility in this pandemic. We will only succeed when we work together as health sector partners, as school boards, as municipalities, as media partners, as parent, as student, and most importantly, as a community together to keep our children safe and keep our community safe. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from AM 800?
Dr. Ahmed, has the health unit been receiving calls from parents looking for advice when it comes to back to school? Are parents asking you and your team if they should send their child back?
We are getting a number of questions, emails from concerned parents, from various other partners as well. And we are trying to group all these questions together to provide the best advice through our team. But recognizing that a lot of these questions are linked with stress, anxiety, which is understandable as we continue to say that there is no risk-free option. There's a decision that each one of us has to make. Each one of us makes decision in a different way. We all recognize that there are a number of things that are still unknown. There are a number of issues that no one can answer until we actually get into the classroom and see how things are happening, how our children are behaving, how our grade 2, grade 1 students, how they behave in the class. Despite having all these measures, what is the real impact? What is the real, action that's happening in the school setting? We cannot predict that. We can only have all those plans. So I think I can understand the stress and anxiety, and all I can say is everyone is trying to identify all the potential issues, potential challenges, and work together to find solutions to it so that we can have a best laid plan at least. And with all of us working together, we can make it happen. But that also means that parents, students, we all have our responsibility as well. And I think we all need to make sure that we educate ourselves what to do, what is the school plan, and what is their responsibility when we are out in the school. I can understand that it's challenging to teach that to your children, but the additional thing that we have to do at home, and also understanding that the school, their teachers, their principal, they will be working with all the students to provide the same, but we also have to do that. And if all of us are doing it together, taking our responsibilities, we can make it happen.
Before I ask my next question, just wondering, will you be attending or be logged into tonight's special public school board meeting?
I've been invited and I plan to attend to answer any question that would help the board and the school board administration in their planning. So we have done that many times with other partners. We like to ensure that we are engaged in this discussion, which is very important for our community, for our children. So we will definitely be there. I'll be there.
And then finally, it's a tough one for parents because I believe the deadline for both boards, I'm not sure about the French boards in our area, but the English boards, the deadline is this coming Friday for both boards. I know today marks the 1 week at the stage 3, and I know before, I believe you said 14-day period, that's what you look at. This is a tough decision for parents to make by this Friday because just in case there is a spike in COVID numbers next week. So this is a tough one. Is that safe to say?
I would definitely agree with that. This is a very difficult time. There's always these tough decisions that each one of us are making. And we're all in this together, I've said this. And right now, we are just going with the best available evidence that we have. We are trying to mitigate any potential impacts of anything that we can foresee. As best as possible, given the resources, given the challenges. There is nothing that we can say this is the ideal situation, that we have no risk. I would never say that there is no risk. There is always this risk. And I think we just need to feel comfortable knowing that you have all these options. You have all these experts working together to figure out the best way to move forward, and recognizing that no one can come up or not all questions will be answered. Let's just say this way, that there will always be questions that will be left unanswered, and we still have to make our decision. We'll still have to move forward with what is known and continue to work with all the partners to keep revisiting, to keep looking at it. What more we can do. What can we do better to keep our children safe, to keep our community safe? And I think that's the best way we can move forward.
Thank you. Sorry for that background noise.
Any questions from Blackburn?
You mentioned that they're going to put a website together for parents to kind of give them some educational tools for their kids. Is there a timeline for when that will be available?
Our team is working on it. I don't have a timeline, but we recognize that this is important, so we would definitely be interested in putting it up as soon as possible. I don't have a timeline.
Do you have some maybe just some ideas of what will be included in it? I mean, what's kind of most important for parents to convey to their kids?
So obviously, all the resources, some of the toolkit that we have for school, the protocols, the requirements, the hand washing, the masking, busing, all those details that the parents are asking, all those questions. I think all these questions will be there, and with the guidance that parents can use to talk to their children, and also to educate themselves on what to expect when they will go back to school, and from my school perspective, what are the systems that are in place to keep their children safe. So I think it's more to empower them to know more what will happen when they go back to school.
Okay, thank you.
Any questions from Windsor Star?
Yes, good morning, Dr. Ahmed. Maureen covered most of my questions, but I was just wondering, how prevalent is the spread of other illnesses in schools typically, like the flu, chickenpox, strep throat, other things that parents probably just dismiss and send their kids to school with when they don't really realize how severe it is?
Yeah, that's a good question, and I think we always monitor school absenteeism just for that reason, and any absenteeism rate which is in excess of 10% of any class, it triggers an investigation to talk to the school, to the class teacher, and to figure out what could be happening and if there's any type of infectious disease risk. But we know just even from our own children's experience, when they're out in the school, that's when they're catching the bug, when they're transferring it to one to another. So this is fairly common, and many of these illnesses are mild, and it doesn't result in anything severe. But our recommendation is always to keep an eye on your children's health, and if they have any symptoms, like forget COVID, but even like any type of symptom, keep them home. We definitely don't want that children to come to school and potentially infect others. So I think it's more on not only educating them about COVID, but also to expand it to take a look at any other type of illness, and continue to monitor your child health to keep everyone safe. So I think it is important that we know that there will be children, there will be mild symptoms, and it is still our responsibility to keep them at home, and that's the only way we can keep everyone safe in the school.
Thank you.
Any questions from CTV?
Good morning, Doctor. I don't want your face to turn blue because you've talked about this quite a lot in the last couple of days. But coming back to the Devonshire Mall situation, I heard you on the radio this morning on AM 800, and I'm just wondering. So, I guess at the end of the day, should people have doctor's note if they have a medical condition and can't wear a mask? Because I guess it's getting to the point where it could get confusing. So people with the medical condition walk around without a mask, and then the people who don't believe in masks will walk around, and then they'll all convene, wherever they're going to convene, and then that's going to just confuse everybody.
Yeah, it is unfortunate that we are in this situation when people are not taking that responsibility for the community. And as much as I can understand that there are certain rights that we all love to have in this great country, but there's also some limitation to it. When it comes to your social responsibility, there is some social responsibility that all of us has. We know that if we go into that route and require people to ask for some kind of a medical exemption, it adds barriers for people to access that. And as you said, many of the people who even have some medical condition, but they are willing to wear the mask to keep everyone safe. And unfortunately, it's those who have, I don't know what's their motivations, whether it's a political agenda or what, but there are people who unfortunately think that it is okay to do what they want to do and putting everyone else at risk. You never do that with something like, if I am out, I'm driving my car and I'm an excellent driver, but that doesn't mean that I have the right to own the road and drive the way I want and putting everyone else at risk. I would never do that. Same thing. If you're out there, if you are in the community, when you're coming in close contact with other people, you have some responsibility that you have to behave in a certain way to ensure the safety and well-being of everyone. And it's all about taking responsibility. And it's unfortunate that people don't want to take that responsibility. It is right now, it is in the bylaw, it is in the Section 22 order. We're in the middle of a pandemic, and we cannot tolerate all these type of behaviors which would put others at risk. So I would request all these people to please just follow what the recommendations are and do your part. Be a part of the community, be a part of this social responsibility that we all have to work together to contain the virus and keep our community safe.
Okay, we all know it's not a forced thing, like you said this morning, but I mean, might you get to the point where you just say, you throw your hands up in the air and go, okay, fine. Everybody that has a medical condition, get a doctor's note. For those of you who, just want to, not listen to the rules or whatever, then, those are the ones that you can enforce it on.
Well, I don't know if that happens, but I would only expect that people will be responsible and they will do their part. That's all I can say. But and again, I would request everyone just to please follow what take some social responsibility on yourself.
Okay, thanks for that. Appreciate it.
Any questions from Windsorite?
Good morning. I know that over the past several months, as the science has evolved, there's been some question as to whether or not children get COVID-19 or at what rate of severity they get it. And there was talk about Kawasaki syndrome. At this point, how likely are children to acquire COVID-19 compared to adults?
So I think it's a difficult question to answer, even right from the beginning of this pandemic in March, right aligning with the March break, the schools were off. And even before children went to March break, some parents already took their children out of the school. And really, we shielded our children. Many of the individuals who were in the community, whether they were essential workers or not, they they continued their work, but our children were always protected, shielded from all of that. So we can't really say with strong confidence that whether the children are good or bad carrier of the disease, and whether they can transmit whether they can contribute to the transmission of COVID-19 or not. So I think there's some evidence, but I would caution that even at that those evidence may not consider all of these other nuances that we are seeing as a community together. So I would take this evidence to say that maybe children are equally effective or equally at the same risk as adults in terms of contracting, in terms of transmitting, and maybe just because of the behavior, they can be transmitting it more. So I think it does put us in a position that we should not treat that as an entirely a low risk event, and we need to be applying all the best tools that we have to keep our children safe and prevent any transmission in that population. So that's the angle, that's the approach that we are taking when we are providing our recommendation, that just in the absence of that information, but we still know quite a lot about the transmission in adults, and we just need to incorporate that learning, that finding, and apply it into the children and their settings, that how we can keep them safe.
Do you think that to give parents confidence to send their children back to school, they should, base that confidence more along the lines of the preventative measures that are being taken, rather than the fact that there may be a lessened transmission among children?
Well, definitely, and I think that's where our public health goal has always been, that if we are really talking about the safety starts right from your home. The safety starts right from identifying your child's unique need and understanding how your child behave. And no two children are the same, even in one family. No two child are the same, and I've seen that personally as well. So there are certain differences that we have to accept. And then we apply we teach our children what to expect, what to do in those type of situations. So the prevention part is definitely very important when we're talking about what would happen in the school, and obviously the school will do that. But recognizing that if we are doing all of this part, if we are keeping the community transmission at a lower level, and if we are keeping ourselves safe, and if we are keeping a close eye on our children's health or symptoms, and if we're keeping them home when they're sick, we are basically reducing the probability of anyone coming to school with any potential illness. And once they are in the school, you have all these policies, you have all these systems in place to ensure that there's appropriate cohorting is happening, there's appropriate physical distancing is happening, children are wearing masks, children are cohorted in activities that is not high risk activities. So all of these things will help us in, even like if we get to the point of having a case, further transmission risk is reduced. So I think I would focus more on the prevention side, and to make sure that everything we are doing on the back end, that is reducing the likelihood of someone coming to school with COVID symptoms. And then when they are there, I think that's already too late. So we'll have to make sure that we have the system in place to contain it, and then work with the school, with the children, with the teacher, with parents to identify anyone else at risk and take appropriate measure. So so having said that, I think there is all that thinking and all these thoughts are to provide that level of security, an additional layer every time we are adding, and as we continue to learn more and more, we will add more measures, we will add more things to provide that level of comfort to everyone in the community.
Okay, thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. The province has said that they want to have public health nurses go from school to school amid this COVID-19 pandemic. Any updates for us locally?
We are in the recruitment phase for the nurses. We're still determining the roles and responsibilities as they support COVID in the schools. We also have additional nurses that are being hired through our COVID response teams. So we will have people coming into our health unit that will be dedicated to supporting the schools in COVID, and also the general response overall for case and contact management.
Thanks, Teresa. And do you know how many nurses are currently dedicated to that right now, or that you have lined up?
So currently we have approximately 32 nurses doing case and contact management, and additional people supporting COVID work, such as inspections and clerical support with lab results and data entry and our epidemiology support. So there are many more people than just the case and contact nursing staff. And in addition, we will soon be receiving 15 new recruits for the purpose of the COVID response team that will additionally help with the case and contact management protocols, and looking at trying to release some of the nursing staff back to other core essential public health work. And so that is separate than the school-based initiative, but we will continue to look at all of the roles and responsibilities for COVID, but definitely with a focus on attention to schools as they reopen.
So how many recruits is the health unit looking to have dedicated to schools in our region?
So our health unit was allocated 15 nurses, and so that is the that's the amount that we will recruit. We are still trying to confirm the length of the placement specific to schools, but right now we do know it is for the current school year, and maybe beyond, but so 15 additional nurses were allocated for our specific health unit.
Is there any challenges to recruiting those additional nurses?
Well, other than the immense workload by our HR department, they were already in process reviewing applications and doing recruitment and interviews for the case and contact management that was ongoing. And so we have, obviously we work in a unionized environment, so there are practices in place doing internal postings and then external postings. We are aware that, there are nursing needs throughout our community, and we want people to consider if this is a good fit for them, and don't want to, be taken from areas that also need nursing staff. So, it might have implications outside of our health unit, but right now we do have a lot of interest in these positions.
Thank you, Teresa.
Any further questions from AM 800?
Teresa, just to follow up to those questions, those 15 nurses, would that be in addition to what the board asked for at its last board meeting for the additional staff?
Yes, so the additional nurses that the province has allocated to our health unit is separate from the previously approved nursing staff from our board. So we're happy to get more support. We obviously have resource issues during this pandemic, and as I said, as other programs need to provide services through, in other departments, we're hoping that this augment will help release some nurses as well back to other duties. But so there's two pockets. One's from the new province initiative, and one is from the board approved nursing staff as well.
When it comes to the board's call for additional staff, any approval there yet from the province?
Well, we have not received our approved budget yet, so I know that it's imminent, but we haven't received any confirmation as of yet. But they're aware of our needs and our proposals.
Okay, thank you. Have a good day.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
CTV?
No, thanks.
Windsorite?
I just had a question, follow-up about the Devonshire Mall maskless protest. I know that the organizer of that event has said that any businesses that turn them away would sort of be subject to a human rights complaint. Should businesses feel confident that they can actually turn people away if they have an exemption?
So I am not a lawyer, so please do not take that as a legal advice. All I can say is all that is intimidation. There are a number of people who use this language to intimidate people, and it's unfortunate, as I've said it many times, that some of these people are saying that they are being the victim, but it's not. There are exemptions out there, and it's very clearly laid it out for people who actually need it. For people who will not get a satisfactory answer, doesn't matter what we see, what we say, or what we do, these people will not stop at anything. They will just do what they feel is the right thing. Doesn't mean that it is the right thing. And it's all to scare people. And there is no such thing as, people are claiming the human rights. It's a pretty broad definition. And it really has to be something that people are impacted by it based on their basic needs. This is all what we are saying is there are exemptions for people who actually need it, but the law is the law. I cannot claim a human rights issue if a police stop me if I'm driving 50 kilometers over the posted speed limit. I can say it's my human right that I want to drive however I want to drive. It's not. So I think it's just I would just caution that if you're whatever is the law, whatever is the bylaw states, whatever is the Section 22 order states, it is very clearly laid out, and people should read up on it if they haven't read it before. Go to our website. All these exemptions, all those enforcements are clearly identified. Read the bylaw, what it says and what it doesn't, and people should know that there is no violation happening. It's their choice. Some of these choices have some restrictions. Some of these businesses, some of these places where people are going, it's not something that they cannot go. They just have to follow what the rules are, what the law is, and keep everyone safe.
Okay, thank you.
Any further questions from CBC?
Yes, Dr. Ahmed, one more question here. What are the challenges with having public drinking water fountains in outdoor spaces across the city amid this COVID-19 pandemic?
Well, I think like anything that we talk about, any public use facilities, any public access to anything which many people are getting, there is always this chance that that you may come in indirectly contact with potentially some of the virus particle or droplets or that may be on that particular either water fountain, door handle, doorknobs, handrails, anything. So anything that you touch, anything that you have that access, there could be some potential. So when you're out there, you have to be mindful of that, and you should take all the precautions before you touch it or before you use any of these facilities. There are some guidance out there, especially for the water fountain, that when you're going to the water fountain, please make sure that you're running the water for a few seconds before you drink it. There is no evidence at this point, which doesn't mean that it doesn't happen. So I would just caution there as well. But we don't know that if drinking water from a water fountain would put you at a risk for COVID. We know COVID is a respiratory illness, and it has to gain access to your respiratory system through a droplet or through access to your nasal cavity or your oral cavity. With water being a transmitter or a carrier of this virus, we don't know about that. So I wouldn't say that this is entirely safe. Generally, if I'm out there, I would probably bring my own water bottle, and I use that, and I think it's in addition to touching anything, I would be careful. I would just continue to wash my hands, use alcohol-based hand sanitizer before I touch any surface which everyone else is touching, especially in this time around.
Thanks, Dr. Ahmed.
Okay, thank you.